This is pharmacology session covering antifungals, starting out with the azoles. First of all, we understand that the azoles poke holes in the cell wall of fungi by inhibiting ergosterol synthesis. And the fungi have some ways of resisting this. One of the ways they do this is sometimes they'll make a little efflux pump that'll just pump out the whatever the azole is, and it'll also sometimes it will through C14 alpha make some kind of other resistance that affects it. Can't remember. I think anyway. And so the names of these things are fluconazole. And be careful, there's two different ones that start with flu, and I realized this after I made the mnemonic. There's fluconazole, and there's also a totally different one that's not an azole at all, that is flucytosine. So do not get those two confused, okay? This is fluconazole, ends in azole. And there's also itraconazole and voriconazole and posaconazole. And it's kind of important that you memorize this order because it starts with the smallest spectrum and goes to the largest spectrum. And so maybe you could think of some acronym to help you remember it. Maybe 5P might help you, or something, I don't know. FIVP, 5P. So with all of these, pretty much all of them are hepatic, except for fluconazole. Fluconazole is excreted renally, in other words, in your urine. And so with that one, you actually need to adjust the dose. If somebody has some renal impairment, you're going to need to decrease the dose, or else they're going to get toxicity. And fluconazole also has the most cytochrome P450 interactions. It inhibits cytochrome P450 2C9, 2C19, as well as 3A4. It also, they found that it can cause toxicity in the liver, and so there are these enzymes you can track, the ALT and AST, and if those are elevated when you give this to somebody, it means that it's causing liver damage to them. So you need to keep that in mind as well. Another thing this does is it increases the QT interval. So I tried to think of some way to remember all this stuff and keep track of it in some sort of picture that I can go to in my mind where all the information's encoded. And this is kind of what I came up with. So this is an AZ flu. Maybe you think it's an easy flu. I don't know. It's really gross though.
Yeah, we're going to have to move your boards up.